With doctors learning more about COVID-19 every day, new questions are emerging about how the virus operates and what other conditions could possibly be linked to it. So to help answer some of your questions, we're joined by infectious diseases specialist, Dr. Isaac Bogoch. Doctor, I always love having this conversation with you. I feel like I learn something each and every week. Let's jump right in. A woman in Ontario has now tested positive for the virus, not once, not twice, 8 times in more than 50 days since she was first diagnosed. So the question is, could she have been infected multiple times? And does each positive count as a new case in Canada? And also, what does this do about our theory of immunity for those who recover from the virus?
Okay, that's a really interesting point. And of course, as you point out, when we learn more and more about this virus, we can start to have a much better understanding of what these diagnostic tests mean. So this is an interesting scenario that's actually not that uncommon. We know that the virus affects the respiratory tract. She likely had a swab done. The swab was positive. She unfortunately had this infection. And most people, of course, we know recover from this infection. If you go and start swabbing people weeks, 1, 2, 3, 4, even 5 weeks after people recover from this infection, you still may have a positive test. That does not mean that people got reinfected. That does not mean that people are contagious. That does not really tell you anything about whether or not they're immune to this infection. All it means is that there are some shreds of genetic material of this virus that are still in the back of the nose and back of the throat that are making this test positive. So we actually know that people are probably not contagious about 11 days after their infection. And this is a positive test. It's a real positive test, but that person is very likely to have been recovered and not able to transmit this virus to anybody else.
Oh, well, that is very good to know. I think a lot of people are going to be happy to hear that. Let's move on. Doctors from around the world are examining a possible link between COVID-19 and something that we've been hearing about in the press, Kawasaki disease in children. What do we know about this connection, and why do kids seem to be such anomalies when it comes to the virus?
Yeah, so Kawasaki disease is an interesting disease. It's not common, but of course it's not unheard of as well. Any pediatrician will know how to recognize this. And it's really an inflammatory condition in kids, and it can affect the blood vessels, including the heart. It is treatable. And like I mentioned, any pediatrician will be able to identify and diagnose this. So there likely is some signal amongst the noise. There likely is some relationship between perhaps COVID-19 and developing this Kawasaki-like syndrome. Is it going to be common? Nah, probably not. But certainly it's likely there. It's interesting that other viruses do the same thing. And certainly there is a relationship between viral infections and developing Kawasaki disease. And certainly now that we see a global pandemic and so much of COVID-19, it's sort of not surprising that there's a spike in Kawasaki disease as well. Of course, we don't have all the answers, need to learn more about this. But it appears to be related, but luckily not that common.
Well, I want to bring you into this now, because you've been pushing provinces to have them test people with no symptoms. So far, now Alberta and Ontario are going to be moving forward with this. How is this going to look?
Okay, so the provinces are figuring out how they're going to do this. There's a scary word tied to this. The word is called surveillance. Surveillance doesn't mean the government's spying on you or tapping into your phone. All surveillance means is that they're starting to test people in the community who don't have symptoms to see if there is a signal, to see if there's a positive case. And if there's a positive case in a community where we don't really think that there's actual infection being transmitted, you can jump on that. You can say, aha, there's a case here. Let's start testing in and around that area to see if there's other people infected. And then you can essentially identify pockets of infection before they spiral out of control. This is excellent. This is smart. If we definitely should be doing it. Alberta, for example, screened 1,000 asymptomatic people in and around the Calgary area. They found 50 positive cases. They were able to quell that epidemic quickly. And as we move forward in the pre-vaccine era, programs like this are going to be extremely important in keeping populations healthy and also in keeping the economy as open as possible.
All right, we're going to have to leave it there, Doctor, but I just want to say thanks again. Just listening to your answers makes me feel safer. I really appreciate your insights today and your expertise.
Have a great day. Nice chatting.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.